think I got this rolling down. I got it rolling down. I just can't see it. Yeah.
That is our board.
I think you went over this the first day.
Yeah.
I repeat a lot. I'm trying that. That's reinforcement. I mean, repetition brings for reinforcement, so to speak. So now you ask for review. If this is a test question, you have to tell me maybe this is question number 2 or something like that. You have to go down low. This is a test question. White blood cells are larger than red blood cells, true or false? There are many times the size. I kept saying the red blood cells, flexible biconcave disc, 7.5 micrometer. It's a lot smaller than those ones. The white blood cells, sometimes the doctor will say, take WBC with differentials. What does that mean?
WBC? White blood count.
Mm-hmm.
Say white blood.
With differentials. What does differentials mean?
Different.
Because it wants to know how much of each. Like you said, the neutrophils are usually the highest. It's about 50, 60. But in acute infection, they will be increased. So depending on which cell series is increased, the doctor could tell what is going on. We say this is an acute infection. Excuse me. Hello? So like I said, this table is very informative. If you look closely, you see this is a cell. The whole thing is a cell. The membrane, the outer one is called the membrane. Is at the center is the nucleus. Between the nucleus and the membrane is called the cytoplasm. Here, the cytoplasm is not clear. It has granules. That's why they call them granulocytes. Cyto, like we said, means what? Cells. But if you look at this, these two, they have a clear, you can't, there are no granules here. So these two, that is the monocytes and lymphocytes, are called agranulocytes. A means lack of granulocytes. And you see that the nucleus are simpler compared to this one. Okay. Now, next thing is each one has its own functions. So, like we said, when the doctor said take WBC with differentials, if neutrophils are increased, okay, it's an acute infection. If eosinophils, these are eosinophils. Phil, like we said, means love. So eosinophil means it likes eosin stain and it imbibes it and it changes to dark color. So this one are involved in parasitic infection like parasites. So if these ones are increased, it's called what? Eosinophilia. See, eosinophilia means the eosinophils are increased. In fact, this book also gives you what? The normal percentage for each. Let's see.
Wait, can you scroll up a little so I can take a picture of the chart
The cells.
of the cells? Yeah. There.
Okay, wait, let me
There, right there,
include
yep.
all of them. 1, 2, 3, 4. Let me read this so. where the amount. Well, it's in the table somewhere. But like I said, neutrophils are usually the highest. Those neutrophils, like 2 to 3%. Basophils too, not too many. Basophils, like we said, these ones are involved in allergies. They might destroy allergens. What are allergens?
Allergens will cause allergies?
Yeah, very good. Allergens are what cause allergies. You know? So some people have a pollen allergy, they could have a allergy to dogs, cats,
I could be around
dust.
I could be around a naked cat, but once the cat has like dandruff,
Fur.
yeah,
There's a fur, yeah. Some people have food allergy. And of course you have drug allergy. Of course that one's very important. The patient comes into the clinic, do you have any allergies? No. Any drug allergy?
penicillin as well, right?
Yeah. So they might say yes or no. Penicillins, I can rub up any part, right?
Yes.
Now, penicillin, so if they say they are allergic to penicillins. Now, it's good, that's why when you did pharmacology, I briefly give you the class. Penicillin is the prototype. If you say prototype, means that's the first in that class. So they named it after them. It's just like the great-great-great-grandpa. Everybody is taking his surname. Under penicillin, you have amoxicillin, ampicillin, cloxacillin, nampicillin. You see they sound similar, so it's easy to, huh? So it's easy to tell. Huh?
The ceiling.
Yeah, ceiling, yeah. That's right. The ceiling. Okay. So that's the penicillins. And if it says here it's allergic to penicillin, you say what kind of allergy? Because allergy could be mild, moderate, or severe. Mild means just have a little rash, a little nausea. It's okay, give her antihistamine. This is a good drug for that disease. That's no problem. But if it's moderate, severe is the tongue swell up, you can't breathe, it's turning blue. That's anaphylaxis. Anaphylaxis. Or you might say anaphylactic shock. See, it's a severe allergic reaction. Can lead to airway shutdown. And I say bronchopulmonary. Bronchopulmonary. Broncho means the bronchus. Pulmonary means the lungs. It's another word for airway. Airway shutdown.
So when you get that type of allergy, that's when you use the shot or the
Yeah, then I'll take the EpiPen. EpiPen delivers epinephrine. Epinephrine. Epinephrine is another name for what? Adrenaline. Right? Yeah, because this has two effects. First of all, apart from airway shutdown, you also have what? Circulatory shutdown. That is the blood pressure collapse. Okay? Circulatory, that is circulation. That you must say the cardiovascular system. Circulatory. It's a circulation. Okay? Now, adrenaline has, one second, let me, yeah, what's the
When you
question?
get an anaphylactic, they give you penicillin too, right?
For anaphylaxis.
Yeah, they gave me 3 things. They gave me the EpiPen, something for my asthma, and there was something else.
Okay, maybe you're mixing up. Let me explain. Now, first of all, each patient is different. There might be a reason why they maybe, I don't know how long ago was this.
I was pregnant, but they didn't know I was pregnant. It was last year.
Okay, now let's say that is it towards the end, the beginning, or during?
It was the beginning. What, the anaphylactic?
You are spiking fever and stuff like that because penicillin is an antibiotic. The only reason they will give you penicillin if they see an infectious process, infection, for which you could be spiking fever, and stuff like that. But maybe you are allergic to that penicillin. They decide to give you EpiPen. So maybe you're not confuse everything together. You did because you just see that they're giving you this, they give you this.
I had an anaphylactic and my airway was closing. So they stuck me with the EpiPen. They
Okay.
gave me something for the asthma and they gave me something else.
Okay, let me explain. Let me give you this. Maybe you remember. I explained this story from oncology briefly. Maybe you remember. Let me explain it briefly. Now, epinephrine, we said it's also called what? Adrenaline. Okay? It's also released in your body by the sympathetic nervous system, the system for fight or flight. We said the autonomic nervous system is very sympathetic. That is, if you're in danger, Friday night you get your paycheck, you are happy, you're going home, the boys know that you are loaded. They are waiting for you at the corner. Your head swells up. Your heart starts beating. Your airway opens up. You can, even in the dark, you can see clear. Those are the effects of adrenaline. That's the adrenaline rush. That's the very adrenaline. So once you've escaped that area, it now goes down, and the parasympathetic, which is for rest and digest, will now take over. So it will reduce the heart rate. Its effects are opposite. So let me explain. Epinephrine, wonderful. Why? It has 2 effects. They'll say what? Beta 1. Beta 1 effect. We say pronounce beta. In beta 1, it will increase the heart rate. And the force of contraction. Okay? You see, maybe let me quickly explain blood pressure for you. Blood pressure itself, BP, is a product of cardiac output. So you see why the increase in this will increase the blood pressure, because it fixes this blood pressure. We said the blood pressure drops, circulatory shut down, that will drop the blood pressure. It's a cardiac output, CO times peripheral resistance. Now, this cardiac output is a product of the heart rate. This one. And stroke volume. Stroke volume is the amount of blood pumped out of the heart when it contracts once. So if this increases the force of contraction, it will release all the blood inside the heart. There are conditions whereby the heart receives, let's say, 80 mils, and only pumps out 50. Then after a while, it pumps out 40. It's holding back 50. Then it's holding back 40. It will be enlarging. That's heart failure. And it's dilating. So you need to give that patient something that will increase the force so that you keep everything out.
And the heart wouldn't sound like loved up, right?
Yeah,
Does it sound
lobbed up.
different?
That's the rhythm. Lobbed up.
I'm saying like when they have a heart condition, it sounds different.
Of course, depending on the heart condition. I'm trying to explain adrenaline because in that shock, in that anaphylactic shock, they will give you epinephrine, they will give you antihistamine, they will give you dopamine. Now, let's say the person is not, because this shock now is your level. Let me just, since you're now asking this question, let me just go a little. If I were you, I'll quickly read it after this. There are many types of shock. You could have a septic shock. Sepsis is infection. For that, of course, you will need antibiotics. Okay? Sometimes a patient will have a combination of things. Oh, he has this, he also has this. So they might end up giving you this. But for anaphylactic shock, if they ask you what did they give for anaphylactic shock, you say penicillin. That's no, you get it mixed up. Please just read it. Go and read it. Say, yeah, read penicillin or read anaphylactic shock.
I'm looking it up.
Yeah. So now, when I say bronchopulmonary, means it opens up the airway. That's the beta 2 effect. It opens up the airway. The antihistamine, it will,
that's what they gave me.
it will block the allergy.
It says epinephrine, antihistamine, steroid.
Hello. You are dealing with a doctor here. Hello. So is it because when I write my name, I don't put my okay, they are empty.
Yeah, that's what it says.
Sometimes when you say the picture, they're laughing at you. You say, oh, really? Oh, they give you penicillin for anaphylactic shock? Please. It's an antibiotic. It's for infection. Don't worry. Bit by bit. At least you know that now. You'll never forget. You guys are due for a break, right?
You